Today we will discuss gastroenteritis. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Gastroenteritis, often called stomach flu, is an inflammation of the stomach and intestines. In simple terms, it means your stomach and gut are irritated, which can lead to symptoms like diarrhea, frequent watery bowel movements, vomiting, feeling sick to your stomach and throwing up, stomach cramps, pain or discomfort in your belly, nausea, a feeling of wanting to vomit, fever, sometimes a mild fever may occur. How to know if you have gastroenteritis? You might suspect gastroenteritis if you experience 1. Recent symptoms. If you suddenly have diarrhea and vomiting. 2. Duration. Symptoms typically last a couple of days but can vary. 3. Exposure. If you've been around someone who is sick or ate contaminated food. If you have severe symptoms such as high fever, blood in your stool, or signs of dehydration, like dry mouth, dizziness, or decreased urination, it's important to see a doctor. If someone has gastroenteritis, here's what to do. 1. Stay hydrated. Drink plenty of fluids like water, clear broth, or oral rehydration solutions to replace lost fluids. 2. Rest. Encourage the person to rest as much as possible. 3. Eat light. When they feel ready, offer bland foods like toast, rice, bananas, or applesauce. 4. Avoid certain foods. Stay away from dairy, fatty foods, and spicy foods until they feel better. 5. Wash hands. Make sure everyone washes their hands often to prevent spreading the illness. 6. Seek medical help. If symptoms are severe or last more than a couple of days, contact a doctor. In the hospital, if someone has gastroenteritis, the staff usually does the following. 1. Fluids. They may give fluids through an IV, a tube in the arm, to help rehydrate the person. 2. Medications. They might provide medicines to reduce nausea or treat symptoms. 3. Monitoring. Medical staff will keep an eye on vital signs like heart rate and temperature to watch for any complications. 4. Diet guidance. They will help with proper diet choices as the patient starts to feel better. 5. Rest and care. The patient will be encouraged to rest while receiving care and support. These steps help the patient recover safely and quickly. Here are some commonly used medications for gastroenteritis. 1. Antiemetics. These help reduce nausea and vomiting. Ondansetron, Zofran, often used to control vomiting. Promethazine, Phenergan, can help with nausea and motion sickness. 2. Antidiarrheals. These can help reduce diarrhea. Loperamide Imodium reduces the frequency of bowel movements. Bismuth subsalicylate, Pepto-Bismol, can help with diarrhea and upset stomach. Rehydration solutions. While not a medication per se, oral rehydration solutions like Pedialyte are crucial for replenishing lost fluids and electrolytes. 4. Probiotics, sometimes used to help restore gut bacteria balance. Always consult a healthcare professional before taking any medication, especially for gastroenteritis, to ensure it's appropriate for the specific situation. Certain groups of people are at a higher risk of developing gastroenteritis. 1. Young children. Their immune systems are still developing, making them more vulnerable. 2. Older adults. They may have weaker immune systems and could be more affected by dehydration. 3. People with weakened immune systems. Those with conditions like HIV/AIDS or individuals undergoing chemotherapy may be at greater risk. 4. Travelers. People visiting areas with different food and water safety standards can be more prone to infections. 5. Anyone in close quarters, living in group settings like dorms or nursing homes, can increase the chances of spreading infections. 6. Food handlers. Those who work with food may be at risk if they don't follow proper hygiene practices. Now you need to watch my video on hyponatremia or have a look at otitis media.